Hello, and welcome back to the channel. It is your community public health safe space where meaningful conversations take place. And today we're back at it again. Another cold day, but we've got much to discuss. I hope you are enjoying the videos, enjoying the walks, and I want you to keep commenting in the comment section, keep leaving questions, because you never know when your question will become a topic that we'll discuss. And today we're going through another public health conversation. We've had questions that were submitted and we'll answer a couple of those, and myths that we always want to debunk because we want you to be well informed, well equipped on your advocating journey. So let's get this walk started. Let's get the discussion going. See you soon. It's a beautiful day. Today I want to also make a disclaimer. And I'm going to make the disclaimer based on the topics and issues we'll be discussing. Now, this video is for educational and informational purposes only. The content discusses public health data, healthcare systems, and social determinants of health. It is not intended to provide medical, legal, or financial advice. Always consult a qualified professional regarding your personal healthcare decisions. The views expressed are focused on public health awareness and policy discussion. So let's get today's discussion started. Healthcare inequity, the truth about income, education, and survival. Now, as always, I start by posing a scenario. And let's get our scenario going. Imagine two people born on the same day. One is born in a wealthy suburb. The other is born in a low-income rural town. One grows up with access to fresh food, safe parks, strong school districts, and regular doctor visits. The other grows up in a food desert, in an underfunded school district with an hospital that's 45 minutes away by drive. By age 40, one manages mild high blood pressure, the other is on dialysis. This isn't genetics. This isn't laziness. This is healthcare inequity. Today we are telling the truth about how income and education shapes who lives longer, who struggles more, and why we are balancing a healthcare system that was never equal to begin with. Today's discussion can be a bit personal, can be a bit tear-dragging, and will hit on certain points that many will see as their reality. It is important to remember that the conversations in the comment section and in the community page should be respectful. We all aren't at the same socioeconomic or social level, and so I want us to be respectful of each other no matter where we are in society. Now, what is healthcare inequity? Healthcare inequity refers to avoidable and unfair differences in health outcomes. Let me repeat. Healthcare inequity refers to avoidable and unfair differences in health outcomes. According to the World Health Organization, health inequities stem from the conditions in which people are born, grow, live, work, and age. Health is shaped long before someone walks into a hospital. It's shaped by housing, education, income, transportation, and of course, environment. Healthcare access is only one piece of a much bigger picture. Now we want to look at how income shapes health. Income determines where you live, what food you can afford, whether you have insurance, whether you delay care, or whether you fill those important prescriptions. Data from the CDC shows that poverty is strongly associated with shorter life expectancy and higher rates of chronic disease. When someone has to choose between rent and insulin, that's not personal failure. That's a structural gap. And this is what we are trying to explain to ensure that we reduce these gaps. Yes, this is what happens when we're outside. We get a little background noise. But as I was saying, this is what we're trying to do, is to reduce these gaps that exist. Now, there's a hidden health factor. Education affects health through health literacy, employment with benefits, and confidence navigating healthcare systems. Research from Harvard University shows that individuals with higher education levels often live significantly longer lives than those without a high school diploma. Education gives people tools, and tools changes outcome. Now, what we are doing as we go through our daily lives, whether you are aware of it or not, you are balancing your health and healthcare. So you're trying to find a balance within the healthcare system. Well, medical technology is advancing, but access is uneven. And we've had this in many of our discussions. We've come to realize that access is uneven. Telehealth has been expanded, but what about broadband gaps? Preventative screenings exist, but what about people working 2 jobs? Insurance plans exist, but what about high deductibles? We are balancing innovation against accessibility, and accessibility is falling behind. Pause for a second. Have you ever delayed care because of cost? Be honest. Say it in the comment section. Have you struggled to understand medical instructions? Now, I know many people have. Many people have struggled. Have you felt unheard in a healthcare setting? Share your experience below. Public health is personal, and I want you to share it so that we can understand that there is a struggle to balance our healthcare and this healthcare system. Now, there are myths that exist about inequity, and I'm going to speak on 3 myths. The first is everyone has equal opportunity in healthcare. The reality is that our zip codes often predict our health outcomes. It's a painful reality, but it's true. The second myth, hard work guarantees access. The reality, millions of working adults remain uninsured or underinsured. And I'm sure you've heard of the term the working poor. These are the people who are deeply affected. Myth 3, this issue only affects certain groups. The reality, income and education disparities affect communities across rural, suburban, and urban areas. Life is happening even on the most quiet of streets. So let's go over myth 3 again. Myth 3, this issue only affects certain groups. The reality is income and education disparities affect communities across rural, suburban, and urban America. Organizations like the American Public Health Association emphasize that reducing inequities improves overall public health outcomes. And this is true. I won't deny that fact. Now we're moving into our question and answer segment. And we've had a few questions that I deem very important for us to delve into. The first is, isn't Medicaid enough? How many times have we heard this question? Well, to answer the question that isn't Medicaid enough, Medicaid helps millions, but provider shortages, transportation barriers, and coverage gaps, they still exist. The other question, can education alone solve healthcare inequity? Of course not, and we know this, but let's to the answer that I want you to understand. Education helps, but structural policy reform is necessary across housing, employment, and healthcare systems. Our final question that we'll be addressing today: why should this matter to everyone? A public health system is necessary because public health affects workforce stability, productivity, and workforce productivity, economic stability, and national health care costs. We understand that there is a balance that we need to fulfill. But if there aren't policy changes that is inclusive, then we will never have true balance. Income should not determine survival. Education should not determine whether someone understands their diagnosis. And geography should not determine life expectancy. Healthcare inequity is not an accident. It reflects policy decisions, resource allocation, and priorities. The question is not whether inequity exists. No. The question is, what are we going to do about it? And we start now by advocating, by informing ourselves, by making our voices heard within our communities. So, subscribe if you believe public health conversations matter. If you want us to continue growing and learning, we all have to participate. We all have to understand what our health care means. It's not just going to the hospital when we're sick. We're focusing on changing the way we look at health care. It's about preventative care. Thank you so much for joining me. And until our next discussion, enjoy whatever is left of your day, because tomorrow we learn, we grow, and we continue our advocating journey. So let's end this one by taking a deep breath. There is much to discuss, and I look forward to speaking with you in the comments section. Until our other video, take care. Stay motivated, stay blessed.